Depression casts a long shadow. Millions around the world struggle with this serious mental health condition. It's more than just feeling down. It's a darkness that can permeate every aspect of life. This pervasive condition doesn't discriminate. It impacts people of all ages, backgrounds, and walks of life. The consequences of untreated depression are significant. Individuals may experience difficulties in their relationships, work, and overall well-being. The impact extends beyond the individual. Families, communities, and society as a whole feel the strain. The good news is that depression is treatable. By understanding this complex condition, we can take steps to support ourselves and others who may be struggling. Together, let's shed light on depression and pave the way for healing and hope. Depression is a mood disorder. It's characterized by persistent feelings of sadness, hopelessness, and a loss of interest in things you once enjoyed. It's not a sign of weakness, it's a real medical condition. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, outlines specific criteria. These criteria help mental health professionals accurately diagnose depression. Symptoms must be present for at least 2 weeks. They must cause significant distress or impairment in daily functioning. Depression can manifest in many ways. Some individuals experience changes in appetite and sleep patterns. Others struggle with low energy, difficulty concentrating, and feelings of worthlessness. Recognizing the signs and seeking professional help are crucial steps towards recovery. Depression is not a one-size-fits-all experience. It presents in various forms, each with its own set of characteristics. Understanding these distinctions is vital for tailoring effective treatment plans. Major depressive disorder, or MDD, is what we typically think of as classic depression. It involves intense symptoms that persist for at least 2 weeks. Persistent depressive disorder, or PDD, is characterized by chronic low-grade depression that lasts for 2 years or more. Bipolar disorder is characterized by cycles of depression and mania. Seasonal affective disorder, or SAD, is linked to changes in seasons, often occurring during fall and winter. Postpartum depression, or PPD, specifically affects women after childbirth. Recognizing these distinct types is crucial for providing targeted and effective care. The causes of depression are multifaceted and complex. There's no single factor that determines whether someone will develop this condition. Instead, it's often a combination of genetic, biological, environmental, and psychological factors that contribute to its onset. Genetics play a role. Individuals with a family history of depression may be more susceptible. Brain chemistry is also involved. Imbalances in neurotransmitters, such as serotonin and dopamine, can influence mood regulation. Trauma, stressful life events, and chronic stress can trigger or exacerbate depression. Medical conditions, such as thyroid disorders and chronic pain, can also contribute to depressive symptoms. Personality traits, such as low self-esteem and pessimism, may increase vulnerability. Social and environmental factors, including social isolation, poverty, and discrimination, can also play a significant role. Section 5. Depression's ripple effect. Impact on mental and emotional well-being. Depression doesn't exist in a vacuum. It's a pervasive condition that can touch every corner of a person's life. It casts a wide net, affecting various aspects of a person's mental, emotional, and physical well-being. The weight of depression can feel like an unending burden. The interconnectedness of our minds and bodies means that depression can manifest in a multitude of ways. It's not just about feeling sad. It's a complex interplay of symptoms. Emotionally, depression can lead to feelings of emptiness, hopelessness, and worthlessness. These feelings can be overwhelming and persistent. These intense emotions can make it challenging to experience joy, connect with others, or engage in activities that were once pleasurable. The sense of isolation can be profound. The impact of depression extends beyond mood. It infiltrates every aspect of life, making even simple tasks seem insurmountable. It can affect cognitive function, leading to difficulty concentrating, remembering things, and making decisions. This mental fog can be incredibly frustrating. The constant fatigue and low energy levels associated with depression can make it challenging to fulfill daily responsibilities, leading to feelings of inadequacy and guilt. This exhaustion is not just physical, but also mental and emotional. It's a vicious cycle that can be incredibly difficult to break free from. Understanding the depth and breadth of depression's impact is the first step towards finding a way out. Section 6. Navigating the path to healing, effective treatment options. There's hope for those struggling with depression. You are not alone in this journey. Effective treatments can help individuals reclaim their lives and experience lasting relief. Seek professional help from a qualified mental health professional. Psychotherapy or talk therapy is a cornerstone of depression treatment. It provides a safe space to explore thoughts and feelings. Cognitive behavioral therapy, or CBT, helps change negative thought patterns. Medication, like antidepressants, can restore chemical imbalances in the brain. Follow the prescribed dosage and consult with a healthcare provider. Lifestyle modifications, like exercise and a balanced diet, are essential. Stress reduction techniques, such as mindfulness and meditation, can improve well-being. Section 7. Empowering ourselves. Prevention and early intervention. Prevention and early intervention are key to mental well-being. Building resilience helps us grow through hardships and emerge stronger. Nurturing supportive relationships, practicing self-care, and engaging in joyful activities are essential. Recognizing warning signs and seeking help early can significantly improve outcomes. Seeking help is a sign of strength. Early intervention prevents depression from escalating. Addressing depression early sets a positive example, encouraging openness and support. Section 8. Extending a helping hand, supporting loved ones with depression. Supporting someone with depression can feel challenging, but it's crucial to remember that your presence and understanding can make a world of difference. Educate yourself about depression so you can approach your loved one with empathy and without judgment. Encourage them to seek professional help. Offer to research therapists or accompany them to appointments. Listen without judgment and provide a safe space for them to share their feelings. Avoid offering unsolicited advice or minimizing their experience. Remember that recovery is a journey, not a destination. Be patient and understanding throughout the process. Celebrate small victories and offer encouragement along the way. Taking care of yourself is also crucial. Don't hesitate to seek support for yourself if you're feeling overwhelmed or burnt out. Section 9. A Brighter Tomorrow. The importance of mental health awareness. Mental health awareness is not just a trendy hashtag, it's a fundamental aspect of overall well-being. By fostering open conversations about mental health, we can help reduce stigma, promote understanding, and encourage people to seek help when they need it. We need to create communities that prioritize mental health. This means advocating for increased access to mental health services, supporting mental health research, and promoting mental health education in schools and workplaces. Remember, you are not alone. If you or someone you know is struggling with depression, reach out for help. There are resources available, and recovery is possible. By working together, we can create a world where mental health is valued, supported, and prioritized.